All right, the following segment sponsored by Oklahoma CyberKnife. Hey, did you know that liver is the largest internal organ of the human body? It's also one of the most vital, so it's important to be aware of the signs that you might have cancer of the liver. Dr. Heaton, who's a radiation oncologist and medical director at Oklahoma CyberKnife, joining us this morning with some life-saving information. It's always good to see you, Dr. Heaton. Thanks for coming in today.
Thank you.
We were just looking at data here a few moments ago about liver cancer and how it's been increasing in the last 35 years or so.
Absolutely. We're seeing more hepatitis C, and that's unfortunately showing us more hepatocellular carcinoma. And 330 people in Oklahoma, unfortunately, have lost their lives. And we're seeing an increase about 3% per year of the diagnosis.
Okay. And one of the things is this is one of the many diseases in cancers you guys can treat at Oklahoma CyberKnife too, right?
Absolutely. We treat more of the patients that cannot go to transplant or can't have a major resection. But those are a large group of them. And then also we can bridge patients who are waiting for a transplant and treat them and make the cancer, resolve and go and become smaller so they are able to go to a transplant.
Okay, and also about liver cancer, I would think it's like with Alzheimer's. Everybody says, well, I have this. Do I have Alzheimer's? What are some of the signs, what are some of the symptoms that someone would see with liver cancer?
The most dramatic is when they become yellow or jaundiced, and you can particularly see it in their eyes. The white of the eyes becomes yellow. You can have a increase in your abdominal girth, some pain, particularly in the upper abdomen. And just anything that comes and stays and gets worse needs to be reviewed.
All right, so if they're diagnosed, you guys can take care of that at CyberKnife.
Yes, we can definitely review it, look at it, and there will be a whole team of physicians that will be involved in the care. But we're very excited. There are some things that we can do. And we can also treat liver cancer that comes from other spots, from other cancers.
Talk a little bit about CyberKnife, too. I know it's always, in the years that you've been coming in, it's always interesting to me how someone can come in and just walk out, and how it just is, it's a miracle to some folks, isn't it?
It absolutely is. I'm surprised every single day seeing patients on treatment and after treatment, and it's, it is focused radiation, and we just are seeing very little to no side effects, both acutely and long term. So we're very excited about the technology.
How do you compare that to the conventional therapy, like a radiation? How does it compare to that?
Both of those have their places. We need to be able to see the very edge of a tumor, and if we can't, we have to be a little more broad-based. But radiosurgery is an excellent treatment for particularly in organs where we can see the edge.
So someone has already been diagnosed, then would they make the call and make an appointment to CyberKnife?
Absolutely. We are here, to review and to work with patients. Even if I can't treat them, I'm happy to talk with them and find an excellent treatment for them.
All right, our treatment plan, to see them where they can live better then.
Absolutely.
Excellent. Well, thank you very much. And thank you for putting up with our mic going out, too.
Oh, no
You're such a trooper. We hand it to her, and she knows exactly what to do.
Thank
Dr.
you.
Heaton, thank you, ma'am.
Thank you.
It's always good to see you. Oklahoma CyberKnife, 6802 South Olympia Avenue, Suite G100, 71st and Highway 75, 918-949-6676, OklahomaCyberKnife.com.